I'm a dentist. Drilling and filling, the things that you think of a dentist that does, I don't do any of those. My practice is limited to the treatment of jaw injuries, we call TMJ, and sleep apnea. The combination of those I refer to as craniofacial disorders. Pocatello has been my home all my life. I was born here, educated here. It's where my family is, and I chose to come back.
When we first started, it was awful. We were trying to figure out everything on our own, scheduling, insurance, information, numbers. We were basically doing it old school, doing it by hand.
One of the things that medical insurance does pay for is TMJ injuries and sleep apnea. But it just happens to be that only a dentist has the skill, equipment to be able to perform those services, and that's what I'm real good at.
Well, I see about 30 patients a day, 10 new patients a week. When people come into our practice, they've generally seen, 3, 4, 5 different doctors.
Yesterday I had 2 experiences. One, I was literally the 10th doctor she had been to, and the second person, she was into treatment, and I did a procedure, took her pain away, and she says, "I love you." And her husband was sitting there. I told her she's a 2-timer.
We get a lot of correspondence with other doctors, handing them papers, receiving papers, a lot more room for error and loss of the paperwork. It was hard to stay on schedule.
We were having difficulty dealing with insurance companies, providing acceptable claim forms because no one else does what I do. AdvancedMD came in the first place to manage the money. The program allows us to identify, first of all, our diagnostic codes and look for a clean claim before it's actually forwarded on to the various insurance companies. So we know very, very quickly if we have some defective portion of our claim. It's nice to know today instead of in a couple of months.
All of our different procedures that we do have a certain color-coded, and they have the exact amount of time that I need for them. So it makes it really easy.
We don't ask the patients to fill out any paperwork. All the data intake is done by one of my assistants. And in many cases, we have a report that can be generated describing our findings and what we've done about it that day to hand to the patient before they leave. We've cut about 10 minutes per treatment period of the patients, and in the last 6 months we've increased the patient flow about 50%.
It's time. Everything's time management. The less time you have to spend searching for things and finding information means getting patients in and out, therefore seeing more patients, therefore more money and helping more people.
I'm able to review the charts from home. After dinner, I can go home and have dinner, and my wife isn't waiting dinner for me. No matter where I am, I have access to AdvancedMD. We intend to use it in the near future for patients to record testimonials and to be able to have those available on our website.
AdvancedMD has been absolutely amazing. We're learning more every day when we search and find different things that we can use and utilize it.
I have it recommended to several people, and I've had a couple of them that have taken up with AdvancedMD. There are many people who select a service and it doesn't turn out to provide their needs. And I've not had that experience. In almost every case, we get more than we expected.